Hello students, let's study body fluids and circulation. So 15.1 blood, 15.2 lymph, 15.3 circulatory pathways, 15.4 double circulation, 15.5 regulation of cardiac activity, 15.6 disorders of the circulatory system.
Now we will see blood. So it is connective tissue, liquid connective tissue, which consists of the cells like RBC, WBC, platelets and plasma, and it is red in color. pH is slightly alkaline, that is 7.2. Blood volume around 5 liters of the blood is present in body, and viscosity is 5 times more than the water. Functions: main function is nutritive. It supplies glucose, amino acids, vitamins to the all body parts. Excretory: it excretes unwanted substances from the blood, that is urea, uric acid, creatinine from the kidney. Respiratory: blood carries oxygen from lungs to tissue and carbon dioxide from tissues to lung by the hemoglobin transport. Then acid base balance, regulation of body temperature, viscosity, water balance, clotting of blood because of the platelets, maintenance of the colloid pressure, hormone transport, then defense mechanism by the WBCs. These are all the functions of the blood.
So composition of blood, it is mainly of two things. The liquid portion is called as plasma and the solid portion is called as cells. So cells are of three types: RBC, platelets and WBC. So red blood corpuscles, platelets also called as RBC also called as erythrocytes, platelets are also called as thrombocytes, and white blood cells also called as leukocytes. Again, white blood cells are divided into two types according to the presence of granules in the cytoplasm. So if granules are absent, they are called as agranulocytes, and they are of two types, lymphocytes and monocytes. And if granules are present, they are called as granulocytes, and according to the color of the granules we can differentiate these cells. So pink color granules seen in neutrophils, orange color granules seen in eosinophils, and dark bluish color granules seen in basophils. Then plasma. So liquid portion is called as plasma, and it mainly contains water, 80 to 90% water, and then biochemical substances like organic and inorganic. So organic like glucose, fatty acid, amino acid, proteins. So these are all organic compounds, and inorganic like sodium, potassium, chloride, calcium, phosphorus, iodine, iron, magnesium. So these are all inorganic compounds. So these form the biochemicals which are present in plasma.
Hemoglobin definition: it is conjugated protein synthesized in RBC. It gives red color to blood. It consists of two components, heme and globin, and the functions to carry oxygen from lungs to tissues and to carry carbon dioxide from tissues to lungs. And then acid base balance. The normal range average is 12 to 16 gram per cent.
Now we will see blood cells, that is RBC, WBC and platelets in detail. So RBCs, red blood corpuscles, also called as erythrocytes. They are anucleated cells, biconcave. Size is around 7.2 micron. It contains hemoglobin, and so it is also called as red pigment. The lifespan of RBCs is 120 days, and function: it contains hemoglobin which carries oxygen from lungs to tissues and carbon dioxide from tissues to lungs. WBC, they are leukocytes, white blood cells, and they are nucleated corpuscles. So they are divided into two types according to the granules. So granulocytes and agranulocytes, that means granules absent. So granulocytes are of three types: neutrophils, pink color granules; eosinophil, orange color granules; basophil, they are dark blue or black color granules. Agranulocytes, monocyte, and lymphocyte. Lymphocytes again small and large lymphocyte. So platelets, they are small non-nucleated bodies around 2 to 3 micron, present in the smear, consist of the cytoplasm. The normal lifespan of platelets is around 2 to 3 days. Function: to help in hemostasis, that is prevention of blood loss by platelet aggregation or the release of vasoactive substances, and cause vasospasm, so stoppage of the bleeding. Now we will see blood group system. So there are two types, ABO and RH. So these antigens are present on surface of the RBC, and by that we can see the blood groups. And natural antibodies, they are IgM type, they are present in plasma. So total 4 types of ABO blood groups are there, that is A, B, AB and O. So A contains A antigen and anti-B antibody in the serum. B group contains B antigen and anti-A antibody in the serum. AB contains antigen A and B both and no antibody. Blood group O contains no antigen nor A or B, and anti-A and anti-B both antibodies are present in the serum.
Now little bit about RH antigen. So RH antigen, it is discovered in rhesus monkey, and when 1 drop of blood is taken, 1 drop of anti-D from the kit and see for the clumps. So if you see clumps, it is RH positive. If you see no clumps, it is RH negative. And natural RH antibodies are not present. They are immune antibodies. When the RH negative person gets exposed to RH positive blood, then there is formation of antibodies, and then that is called as RH antibodies. So it can be seen in mismatched blood transfusion or hemolytic disease of newborn.
Now we will see blood coagulation. So it is the mechanism of the hemostasis. So hem means blood and stasis means stop, to stop bleeding. Clot is composed of network of fibrin threads and all the blood cells like RBC, WBC and platelets. So it prevents the blood loss. The few steps in coagulation. So after the blood vessel injury, the thromboplastin is released, which converts prothrombin into thrombin, then thrombin converts fibrinogen into fibrin, and then finally many fibrin and all the blood cells come together and it form the clot. There are few coagulation factors present in blood, but when blood flows they are inactive, but when injury takes place they become active. So factor 1 is fibrinogen, 2 is prothrombin, 3 is tissue thromboplastin, 4 is calcium, 5 is labile factor, 6 is not recognized, 7 is stable factor, 8 is anti-hemophilic factor, 9 is Christmas factor, 10 Stewart power factor, 11 plasma thromboplastin antecedent PTA, then 12 Hegman factor, and 13 fibrin stabilizing factor. So the factor 8 and 9, they are related to the hemophilia A and B. So lymph is the fluid which circulates throughout the lymphatic system, and the lymphatic system is made up of lymph nodes and lymph capillaries. So lymph mainly composed of the blood plasma like, but slightly differ. So it contains white blood cells, and mostly in the lymph node it is richer in lymphocytes. And in digestive system it is called as chyle, which is rich in the triglyceride, so the appearance is milky because of the lipid. Circulatory pathways are of two types, open and closed. So open, when the blood is pumped by the heart, passes through large vessels and drains into open spaces or body cavities or sinuses. So example, it is seen in arthropods and molluscs. The closed circulatory system, in that the blood is pumped by the heart, is circulated through a closed network of blood vessels. The closed circulatory system is more advantageous because of the flow of fluid can be more precisely regulated, and it is seen in annelids and the chordates. So now let's study the first structure of the circulatory system is heart. The heart is a thick, highly muscular, contractile and automatic pumping organ of the blood. It is located in the thorax between two lungs. The coverings are four: epicardium, the outermost covering; myocardium, the cardiac muscle, the smooth and involuntary in action; endocardium, the innermost lining of the heart; and the pericardium, which surrounds all over the heart. So pericardium is of two parts, that is parietal pericardium, the outer layer is fibrous in nature, and the visceral pericardium is the inner one. The space between these two pericardium, that is parietal and visceral, is called as pericardial space, and it contains the fluid that is called as pericardial fluid, and the functions of that fluid is prevents friction, protects it from external shocks, and gives nutrition to the heart. And if in any disease the pericardial fluid is increased, then it is called as pericardial effusion. Fishes, they contain hearts of two chambers, one auricle, one ventricle, with single circulation. Amphibians, three chambers, two auricles, one ventricle, with double circulation. Reptiles 3 chambers, but ventricle is incompletely divided by the septum. And crocodiles, there are 4 chambers. Birds and mammals 4 chambers hearts, 2 auricles, 2 ventricles, completely separated by auricles by interauricular and ventricles by interventricular septum, and they have double circulation. Chambers and walls of the heart, so they are 4 in number. So 4 chambers, right atrium, so atrium of 2, left atrium, right atrium, ventricles 2, left ventricle, right ventricle. So valves are 4, so main 2 types, atrioventricular valve and semilunar valve. So atrioventricular valve, so left side between left ventricle and left atrium, it is bicuspid, that is 2 cusps are there, and it is also called as mitral valve, and right side it is tricuspid valve. Semilunar valve, so between heart and the great vessels, so aortic valve and pulmonary valve. The functions of the valves to prevent backflow of the blood, so to carry unidirectional blood flow. Few points regarding right atrium. A small amount of blood from the coronary circulation also drains into the right atrium via coronary sinus, which is immediately above and to the middle of the opening of the inferior vena cava. In the wall of the right atrium, there is a oval shaped depression called as fossa ovalis, which is a remnant of the opening of the fetal heart, that is foramen oval. Great vessels, so they are mainly 2 types, vessels entering in the heart. So superior vena cava, inferior vena cava, they join and form vena cava, and it enters into the right atrium, which carry deoxygenated blood. Pulmonary vein, they are formed from the lungs and they enter into the left atrium. Even if it is a vein, it carries oxygenated blood because it is coming from the lungs. The vessels leaving from the heart, so pulmonary artery, it leaves from the right side of the heart, that is right ventricle, and aorta from the left side, that is left ventricle. So pulmonary artery carries deoxygenated blood and aorta carries oxygenated blood. The circulation of the heart, so there are mainly 3 types: pulmonary circulation, systemic circulation and coronary circulation. So pulmonary circulation is between heart and lungs. So from lungs, deoxygenated blood is carried through the pulmonary vein, enter into the left atrium, and pulmonary artery, it carries deoxygenated blood, it leaves from the right side of the heart and goes to the lungs for the oxygenation. Systemic circulation, so it is between body and the heart. So the vena cava, that is superior and inferior vena cava, they carry deoxygenated blood from all body parts and carry to the right atrium. And aorta, it carries oxygenated blood, it leaves from the left side of the heart, that is left ventricle, and gives the oxygenated blood to all body parts. The third type is coronary circulation. So the left and right coronary arteries, they arise from the aorta and they supply oxygenated blood to the atria and ventricles. Chambered heart, it is a muscular chambered heart, is present in all vertebrates. It is of 2 types circulation, single circulation and double circulation. And double circulation is of 2 types, incomplete and complete. So let's see first single circulation. So in single circulation, the blood passes through heart only once. Example, fishes. The heart pumps out deoxygenated blood to the gills. The oxygenated blood from gills is supplied to body parts. Deoxygenated blood is then returned from different body parts to the heart. Then in double circulation, so first is incomplete double circulation. So oxygenated blood is received by the left atrium and deoxygenated blood is received by the right atrium. But both the blood gets mixed in the single ventricle, which pumps out the mixed blood. In incomplete double circulation, the blood comes to the heart through 2 different routes but goes out through a single route. So it is called incomplete double circulation. Example, amphibians and reptiles. The complete blood circulation, in this the oxygenated blood is received by left atrium, deoxygenated blood is received by right atrium, the oxygenated blood is pumped out through the left ventricle and the deoxygenated blood is pumped out through the right ventricle. In complete double circulation, there are two separate pathways for oxygenated and deoxygenated bloods, and there are two ventricles. So, example, birds and mammals.
Double circulation of heart. So first is pulmonary circulation. Blood pumped by right ventricle enters pulmonary artery. Left ventricle pumps blood into aorta. The deoxygenated blood pumped into pulmonary artery goes to lungs, from where the oxygenated blood is carried by the pulmonary veins into the left atrium. Systemic circulation. The oxygenated blood entering the aorta is carried by a network of arteries, arterioles, and capillaries to the tissues, from where the deoxygenated blood is collected by a system of venules, veins, and vena cava and emptied into the right atrium. This is systemic circulation. The systemic circulation provides nutrients, oxygen, and other essential substances to the tissues and takes carbon dioxide and other harmful substances away for the elimination. Hepatic portal system. Vascular connection exists between the digestive tract and liver, is called hepatic portal system. The hepatic portal vein carries blood from intestine to liver before it is delivered to the systemic circulation. Coronary circulation. A special coronary system of blood vessels is present in our body exclusively for the circulation of blood to and from the cardiac musculature. Right and left coronary arteries arise from the aorta, and then they supply blood to the heart. Nodal tissue. First SA node, that is sinoatrial node. So nodal tissue is present in the right upper corner of the right atrium, called sinoatrial node. AV nodal tissue is seen in lower left corner of the right atrium, close to the atrioventricular septum, called atrioventricular node. A bundle of his sonodal fibers, atrioventricular bundle, continues from atrioventricular node, which passes through the atrioventricular septa to emerge on the top of the interventricular septum and immediately divides into right and left bundle. Purkinje fibers. These branches give rise to minute fibers throughout the ventricular musculature of the respective sides and are called Purkinje fibers. Function. The nodal musculature has the ability to generate action potential without any external stimuli. It is auto-excitable. The sinoatrial node can generate maximum number of action potential, that is 70 to 75 per minute, and is responsible for initiating and maintaining the rhythmic contractile activity of the heart. Therefore, it is called pacemaker of the heart. Our heart normally beats 70 to 75 times, average 72 beats per minute.
Cardiac cycle. The heart beats continuously throughout the life. So cardiac cycle begins with the atrial contraction, that is atrial systole, which is initiated by electrochemical stimulus coming from the SA node, that is sinoatrial node, which is also called as pacemaker because it initiates that impulse. The stimulus is transmitted through atrioventricular node to bundle of his, which spread to Purkinje fibers on the ventricle. Then during atrial contraction, the blood from atria is forced into the respective sides of the ventricles. The ventricles now undergo powerful contraction, that is ventricular systole, during which bicuspid and tricuspid valves remain closed. When the ventricular blood pressure increases, that is systolic pressure, then the aorta and pulmonary artery, the blood enters these arteries through the semilunar valves, that is aortic and pulmonary valves. When the blood enters the arteries, the ventricular relax and the ventricular is called as ventricular diastole, and the pressure is diastolic pressure. It then falls. Simultaneously, the atria have relaxed, the atrial diastole, and the blood rushes in the ventricles from vena cava and pulmonary veins. Now the ventricles are ready to receive blood again. So this way, the body, even at rest, the heart beats 70 times per minute, and each cardiac cycle lasts for 0.8 seconds. In this way, the cardiac cycle continues. So cardiac cycle is the alternate atrial and ventricular, systole and diastole, contraction and relaxation. The sounds are produced because of the closure of the valves, that is atrioventricular and semilunar valves. That sound is called as heart sounds, and they are mainly two: first heart sound and second heart sound. So first heart sound is due to closure of the atrioventricular valve, and it is heard as the lub, L-U-B-B, with the stethoscope. The second heart sound is due to closure of the semilunar valves, and it is heard as dub, D-U-B, and with the stethoscope. When there are abnormal heart sounds due to defects in the valves, they are called as murmurs, and these heart murmurs can be caused by blood flowing through the damaged or overworked heart valve, and then by listening these murmurs or abnormal heart sounds, you can diagnose the disease of the heart. Arterial blood pressure. So blood pressure is defined as the lateral pressure exerted by blood against the vessel walls. So it is of two types, systolic and diastolic. So the maximum pressure exerted when the ventricular contraction, it is called as the systolic pressure, and the minimum pressure when during the ventricular relaxation, that is diastole, is called diastolic pressure. The normal blood pressure is 120/80. That means systolic pressure is 120 mm of mercury and diastolic pressure is 80 mm of mercury. The blood pressure is measured by apparatus called as a sphygmomanometer, and when there is more than 140/90 mm of mercury blood pressure, it is called as hypertension. There are few factors which affect the blood pressure. So cardiac output, blood volume, viscosity of blood, age, sex, build, and sleep and emotion. And in pathological conditions, it is kidney disease, anemia, or high level of the cholesterol and triglyceride in the blood, that is obesity. Let's study about the echocardiography, that is ECG. So it is the process of recording of electrical activity of the heart over a period of time using electrodes placed on the skin. So these electrodes detect tiny electrical changes on the skin that arise from the heart muscles. Electrophysiological pattern of depolarizing and repolarizing during each heartbeat. It is very commonly performed cardiology test. So the machine is called as electrocardiograph, is used to obtain the electrocardiogram. So ECG is a graphical representation of the electrical activity of the heart during the cardiac cycle. Procedure of the ECG. So 10 electrodes are placed on the patient's limbs and the surface of the chest. The overall magnitude of heart's electrical potential is then measured from 12 different angles and is recorded over a period of time, usually 10 seconds. In this way, the overall magnitude and direction of the heart's electrical depolarization is captured at each moment throughout the cardiac cycle. The graph of voltage versus time produced by this non-invasive medical procedure is referred as the electrocardiogram. So now in standard ECG there are few waves, so that is P wave, QRS complex, and T wave. So P wave represents the electrical excitation, that is depolarization of the atria, which leads to contraction of the both atria. The QRS complex represents depolarization of the ventricles, which initiates the ventricular contraction. The contraction starts shortly after Q wave and marks the beginning of the systole. The T wave represents the return of the ventricle from excited to normal state, that is called as repolarization. The end of the T wave marks the end of the systole. By counting the number of QRS complexes that occur in a given time period, one can determine the heartbeat rate of the individual. ECG of the great clinical significance, because from different individuals roughly there is a same type of shape, but if any deviation in the shape takes place, indicates the abnormality or the disease of the heart. So ECG conveys the large amount of information about the structure of the heart and function of the heart. So ECG can be used to measure the rate and rhythm of the heartbeats, size and position of the heart chambers, presence of any damage to the heart's muscle cells or conduction system, the effect of the cardiac drugs, and the function of the implanted pacemakers. So it is of great clinical significance. So blood vessels, there are few different kinds of blood vessels. So first is artery. So this is the artery which carry, so it is a blood vessel which carry blood from the heart so it is away from the heart. So it is thick walled artery because it carry blood under the increased pressure. Then branches of artery is called as arteriole. Then smallest branches of the blood vessels is called as capillaries. Then capillaries join and form venules, and venule join and form the vein. So important great vessel is vena cava, which is formed by combination of the superior vena cava and inferior vena cava. Now we will see difference between artery and vein. So artery is the blood vessel which carry blood away from heart. Vein is the blood vessel which carry blood towards the heart. So artery carries oxygenated blood except pulmonary artery. Vein carries deoxygenated blood except pulmonary vein. Arteries are deep in location, veins are superficial. Artery wall is thick because it carries blood under increased pressure, and vein wall is thin because it carries blood under normal pressure. So arterial blood collection is used for the blood gas analysis, and mainly radial artery is used, and veins are superficial, so easily we can do collection for all biochemical and serological testing.
Regulation of the cardiac activity. Normal activities of the heart are regulated intrinsically, that is auto-regulated by specialized muscles. Hence, it is called heart is the myogenic. A special neural center in the medulla oblongata can moderate the cardiac function through autonomic nervous system. Sympathetic nervous system, part of ANS, can increase the heart rate, then heartbeat, and then strength of ventricular contraction, and thereby the cardiac output. The parasympathetic neural signal decrease the rate of heartbeat and speed of conduction of action potential, and thereby the cardiac output. Adrenal medullary hormones can also increase the cardiac output.
Now we will see disorders of the circulatory system. So it is because of the lifestyle diseases that depends on the person's habits, diet, smoking, or any other history of the addiction. So first is the coronary artery disease. It is referred as the atherosclerosis. So atherosclerosis means it is thickening of the artery. So it is because of the deposition of calcium, fat, cholesterol, fibrous tissue. So because of that, the lumen of the artery is narrow, and then there is deficiency of the oxygen to the heart tissues. So it is a risk factor for the acute coronary syndrome. So the second is the high blood pressure, hypertension. So normal blood pressure is 120 by 80, and if the individual's pressure is more than 140 by 90, then it is called hypertension. And high blood pressure leads to heart disease and also affects the vital organs like brain and kidney. So angina is also called as angina pectoris. So it is a chest pain because of the not enough oxygen is reaching to the heart muscle. Next is the heart failure. So it means the state of heart when it is not pumping blood effectively enough to meet the needs of the body. It is sometimes called as congestive heart failure because of the congestion of the lungs is one of the main symptom of the disease. So it is not a cardiac arrest when the heart stops beating, or heart attack when the heart muscle is suddenly damaged by inadequate blood supply. Hope you find this session useful for your understanding and for your exams. Thank you.